giving out information free of cost. Let's talk about the contemplation we're facing on vaccination. Help the dying generation vaccinate. Let us try to heal the nation. Wait, but there's a debate. People are wondering why we should vaccinate. First of all, prevention is better than cure. Second of all, getting the vaccination is not mandatory, but it's mandatory for you to know it's your responsibility to keep you, your family, and community safe.
So do the right thing and vaccinate.
Vaccinate, 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 vaccinate. It's not too late, don't procrastinate. Vaccinate, 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 vaccinate. It's not too late, don't procrastinate. Vaccinate, give it a beat. Vaccinate, instead of defeat. Vaccinate, give it a beat. Vaccinate, give it a beat. Vaccinate, instead of defeat. Vaccinate, I'm ready to beat. Vaccinate. Many are afraid of the vaccination due to the miseducation, like Lauren Hill. No disrespect, but we will get entangled if bad news escapes like a bird in a cage. But what we want to do is put Corona in a cage. The vaccine is safe. Anybody can take it from the individuals with autoimmunity, comorbidities, living with HIV. It doesn't even have an effect on your fertility. The only ones exempted from taking the vaccine are pregnant women and children and those with previous allergic reactions to an mRNA vaccine. Vaccinate, 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 vaccinate. It's not too late, don't procrastinate. Vaccinate, 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 vaccinate. It's not too late, don't procrastinate. Vaccinate, give it a beat. Vaccinate, instead of defeat. Vaccinate, give it a beat. Vaccinate, give it a beat. Vaccinate, instead of defeat. Vaccinate, I'm ready to beat. Vaccinate. Let's talk about the past, don't forget the ones who passed. Remember when thousands died of polio and measles from the lack of a vaccine. Since don't have a repetition, get the vaccine. The side effects are at the minimum, similar to the minimum flu-like symptoms. Severe allergic reactions have only been reported in a small percentage. The virus is relentless. The vaccines help our body to develop immunity.
So do the right thing and vaccinate.
Good morning from the Faculty of Health Sciences at the University of Pretoria. We are broadcasting live from the Future Africa Institute and campus. Thank you for joining us today. My name is Manibikanyo, Head of Marketing and Communications at the Faculty of Health Sciences. It gives me great pleasure to welcome you all to the Faculty of Health Sciences Choose UP virtual event. Joining me in studio today is Prof. Twoyear, Dean of the Faculty of Health Sciences, Prof. Prashila Soma, Head of Department of Anatomy at the Faculty of Health Sciences, Dr. Tshepiso Mfolo, Dentist and Lecturer at the School of Dentistry at the Faculty of Health Sciences, Ms. Celissa Anthony, Manager of the Undergraduate Student Administration at the Faculty of Health Sciences, Ms. Mberi Shiyorikisa, Health House Executive Committee Chairperson, Pulse Executive Committee Chairperson. We'd love to engage with you during today's live stream, so please tweet us and let us know who you are and where you are watching the event from. Remember to use hashtag ChooseUP2022. If you haven't already done so, follow us on Twitter and Instagram.
At the University of Pretoria's Faculty of Health Sciences, we like to focus on potential. The potential of our students to make a positive difference to the world around them. The potential to produce research that shifts boundaries. The potential to heal, to relieve, to recover and restore. Discover your potential and join the movement. Follow the University of Pretoria's Faculty of Health Sciences on Twitter, Instagram, Facebook, YouTube and LinkedIn to be a life changer.
Your participation in today's event also means that you stand a chance of winning one of 4 lunch vouchers as well as 2 bookmark vouchers. Winners will be announced during the program, so please stay tuned as you could be taking home one of these fabulous vouchers. We have an exciting program in store for you. And to kick off today's session, I'd like to introduce Prof. Twoyear, our Dean at the Faculty of Health Sciences.
Good morning. I'm Twoyear, Dean of the Faculty of Health Sciences, and welcome to this live event hosted by Health Sciences as part of the hashtag ChooseUP initiative. Why should you choose to study at UP's Health Sciences? Our faculty, situated at Prince of Campus, has a reputation of producing excellent healthcare professionals, changing lives globally. We are creative and innovative, as you have seen during crisis times like Fees Must Fall and now during the COVID pandemic. Our students successfully graduate on time. We are continuously transforming. Transformation of the curriculum, facilities, and the culture in the faculty are important, in addition to racial diversity. This keeps us relevant, and with 43 departments across 4 schools, our faculty offers one of the most diverse range of programs for you to choose from. You can follow a career based on your passion within the School of Medicine, the School of Dentistry, the School of Healthcare Sciences, or the Postgraduate School of Health Systems and Public Health. This session is focusing specific on MBCHB or Medicine and BCHD or Dentistry. Places for these programs are limited and it is very competitive. Taking all these programs into consideration, the faculty maintains an average module pass rate of around 95%. Your success is important to us. We have academic and mental health support systems in place, and our leading hybrid learning approach will ensure that you can continue achieving success the UP way. In addition, we are well renowned for our vibrant student life and the culture surrounding it. We want you to develop to your full potential and in a safe and stimulating environment. Our staff are dedicated leaders in their respective fields and are passionate life changers. By using our advanced infrastructure, laboratories, libraries, and leading research facilities, students at the Faculty of Health Sciences develop essential skills and gain reputable experience. At institutional level, UP ranked number 1 in Africa on the UniRank Global Ranking System for Universities. On the QS Global Ranking, we are within the top 1% globally for clinical medicine, immunology, and microbiology. With the THE ranking, we are the only South African university that ranked for SDG 3, that is, health and well-being, and are amongst the top 200 globally. We hope you will choose UP and join the Faculty of Health Sciences and become a life changer too. Enjoy the program, and I trust that we will answer all your questions.
Thank you so much, Professor Twoyear. As we've promised, we already have our first winner for today. We have our winner who takes home a bookmark voucher valued at 500 Rand. It goes to Lepelo Maseti. Doctors and dentists and healthcare providers who graduate from UP are sought after nationally and globally because of the high quality training they receive and their exceptional skills. And obviously the fact that they're well-rounded professional individuals. I'd like to introduce you to the School of Medicine and Professor Soma. Over to you.
The quality of teaching and learning at UP's School of Medicine continually produces top-class researchers and medical practitioners. Many of our graduates become top doctors and researchers in the country, highly sought after because of their skill set. We blend clinical training with modern cutting-edge teaching and learning practices. We house exceptional lecturers with a passion for their work. A specially tailored curriculum allows our students to join the ranks among international players. We cover a comprehensive scope of study comprising 29 departments. our students go beyond their call of duty to overcome mediocrity and rise to excellence as they benefit from theory in classrooms to practical experience in community hospitals and clinics, fighting poverty-related diseases, promoting good health and well-being. We prevent loss of life. The School of Medicine at UP's Faculty of Health Sciences, leaving an impact and changing lives.
It is so good to be here today. What an exciting morning this is turning out to be, even though it is virtual. I was asked to share some thoughts that may be relevant to you as you start this incredible ride of yours. What an exciting time to be studying medicine. Welcome to the School of Medicine. Where does the School of Medicine fit into the Faculty of Health Sciences? In our faculty, we have 4 different schools, namely School of Medicine. So should you want to study to become a doctor, this is the school you will be enrolling in. Should you opt to study dentistry or dental therapy, School of Dentistry will then be your choice. Should you be interested in physiotherapy, occupational therapy, or nursing, then you will be part of the School of Healthcare Sciences. The School of Health Systems and Public Health is one of our hugest postgraduate disciplines. Unlike me, you will probably be practicing medicine in a very different way. I am currently using a stethoscope to listen to people's hearts. I am using a sphygmomanometer to measure people's blood pressure. You, on the other hand, would probably be using fancy techniques, robots, who knows what other kind of equipment, and definitely be using artificial intelligence. Artificial intelligence is transforming the way we are looking at medicine so that doctors can make more accurate diagnoses, so that we can predict future diseases and predict better treatments. In order to become a doctor, you need to enroll for an MBCHB degree. Once you have completed your MBCHB and you have a desire to become a specialist, you would then have to sign up and register for an MMed degree. So if you want to become a pediatrician, then you will need to do an MMed in pediatrics. What does studying a doctor actually entail? It is comprised of 6 years of academic training. Your first year will be made up of subjects like physics, chemistry, medical terminology, psychology. First 6 months will be spent on the Hatfield campus, and then from June you will move over to the medical campus here on the Prince of side. In your second year, it's when the fun and games begin. In your second year, anatomy will form an important part of your learning. And anatomy is where I am currently working and the head of the department. You will be learning some of the most profound knowledge the human race has been able to discover and contribute to your own ever-evolving field dedicated to improving human life. In our cadaver hall, or dissection hall as we call it, you will be able to lift lungs that have given air. You will be able to hold a heart in your hand that has beat more seconds than the time you have walked on this earth. You will be amazed by the convolutions and gyri of the brain. And I'm sure you will be wondering, what were the memories of this person that donated their body to science? In your fourth year, we will then be starting our clinical rotations, where you will be spending mornings in different disciplines. So, for example, like surgery, internal medicine, psychiatry. Fifth and sixth year, primarily clinical training, and most of your time, if not all, will be spent then in different teaching hospital facilities. It will then be followed by a 2-year internship program and a 1-year community service. Fortunately for you, you will start earning a little bit of a salary once you've completed your 6 years. What are these different MMed programs we were talking about, and what are the different specialities? So some of them include pediatrics, gynecology, internal medicine, surgery, and anesthesiology. We will be looking at some of the other ones. Being a physician has always been considered a noble and honorable profession. But since the COVID-19 pandemic, most doctors, nurses, in fact, all healthcare professionals in the front line have now been classified as bona fide heroes. A cardiologist is another specialist. What do cardiologists do? They're the ones that usually look at heart diseases, which include things like high blood pressure, people who present with heart attacks. Should you have an electrical abnormality, if you have a murmur, you will be referred to a cardiologist. What does a radiologist do? Again, you need to complete your 6 years MBCHB, your internship and community service, then become an MMed or a registrar. Radiologists are those specialists who will interpret all different investigations. Ones that most of you have heard of are chest x-rays or an abdominal sonar or maybe the CT scan of the brain or CT scan of the chest. Those of you that have a passion for working with children, then pediatrics will automatically become the first option for you. Those of you that feel you were born to hold a scalpel in your hand, then maybe neurosurgery is what you should do. So a neurosurgeon are usually those that operate on the brain and spinal cord. Forensic pathologists are all those doctors who speak on behalf of those who cannot speak. We as medical professionals would like to know what was the cause of death. So a pathologist will then cut up and do a full dissection of the body, send certain tissues away, look at histology as to come closer as the cause of death. Then we have general surgery. So a surgeon can operate on the nose. Most of the surgery is confined to the abdomen, and this is the doctor you will go and see should you have an appendix bound to rupture, or if you have a mass or a tumor in your colon, then the surgeon will be the person that you will be referred to. But with medicine, there are many, many options. You can opt to be a neurologist, a thoracic surgeon, or obstetrician, or an ENT surgeon. Should the lungs be fascinating to you, you can always go and specialize in pulmonology. Ophthalmology are those people who are experts in all eye-related diseases and surgeries. Whether you go into research, business, law, medicine, or education, neither you nor society can continue to survive simply by implementing what we already know. Somebody is going to have to come up with meaningful ideas, new innovative approaches, new meaningful ideas. Why can't that person be you? Thank you so much.
Thank you so much, Prof. Soma. I see that we have a lot of questions coming through from our viewers. So please remember to ask your questions as we will be addressing them during our Q&A session. I'm sure most of you are inspired and you have a multitude of information with regards to what our medicine or School of Medicine has to offer. Now it's time for us to give away one of our vouchers. Congratulations to Lara Prinsloo for winning our lunch voucher. Without further ado, I would like to hand over and introduce the School of Dentistry and Dr. Sipiso Mfolo to tell you more about the programs on offer.
I am a dentist. Each day I treat patients who need me to give them something to smile about. I give my patients and my community a healthy body and lifestyle by restoring their oral health and function, free from pain and with great looks. As a dentist, I'm a member of a team whose multidisciplinary approach improves the total health of our patients. The team consists of me and dentists who have chosen one of the 6 fields of specialization. We all play our part in managing and restoring the oral health of our patients. Each patient that I see is unique. I hear their concerns, examine them with care, diagnose their problem and create an individualized oral health solution to manage their specific oral health needs. As part of UP's Faculty of Health Sciences, The School of Dentistry aims to produce diverse and competent dentists. We improve the quality of life of our patients and of the community by training our graduates in the state-of-the-art facilities in order to thrive in an ever-changing healthcare environment. Apply for the course Dentistry at UP. Become a life changer because great smiles, changed lives, and the quality of life go hand in hand.
A very good morning to you, and thank you for tuning in into this live stream. I am Tshepisa Mfulo, and I'm a community dentistry lecturer at the University of Pretoria. I'm here to convince you as to why a career in dentistry is the best decision you will ever make. So the School of Dentistry is one of the 4 schools in the Faculty of Health Sciences at the University of Pretoria. It's part of the School of Medicine, the School of Healthcare Sciences, and also the School of Health Systems and Public Health. The School of Dentistry is situated at the Oral and Dental Hospital in the Princehof South Campus of the University of Pretoria. We have 2 undergraduate programs, Bachelor of Oral Hygiene, which takes 3 years to complete, and we have Bachelor of Dental Surgery, which takes 5 years to complete. There are 8 departments within the School of Dentistry. We have the Department of Dental Management Sciences, the Department of Maxillofacial and Oral Surgery. We have the Department of Odontology. We have the Department of Periodontics and Oral Medicine. We have the Department of Prosthodontics. We have the Department of Orthodontics, and we have the Department of Oral Pathology and the Department of Community Dentistry. Out of those 8 departments, there are 6 specialty departments within the School of Dentistry. Now, our facility provides an area of platforms. We have a teaching and training platform for oral hygienists, dentists, and dental specialists. We have a service platform to render services to patients. We have a research platform for students and staff. Now, you may be asking, why should you choose a career in dentistry? Dentistry forms an important part in the health system. Producing dentists and oral hygienists, as well as specialists in the dental field, makes the school an important role player in the country. And not only that, but it excels in the training of these professionals, and it provides an indispensable service to the community at large. We contribute to the prevention and management of oral conditions, conditions like dental caries, like periodontitis, like oral cancer. We improve the quality of life of our patients. As we all know, the mouth is used for many functions. We smile, it's for aesthetics, it's for eating, it's for chewing. So we use our mouths for an area of things. Therefore, the quality of life of a patient is of utmost importance. Here at the University of Pretoria, you will receive quality education, which has exceptional reputation, both locally and also globally. You will be exposed to current, cutting-edge, relevant research. You will have access to work opportunities. If you are from the University of Pretoria, you will have an area of work opportunities by your side. At the School of Dentistry, there are certain values that we uphold. One of the values that I'll be telling you about is excellence. We have dedicated staff members. At the School of Dentistry and the University of Pretoria, we pride ourselves in the recruiting process. We have highly skilled staff members who are committed to the profession. We also have the state-of-the-art facilities and equipment. We have state-of-the-art skills laboratories, state-of-the-art library, and state-of-the-art facilities within our institutions. We have accredited programs that are accredited by our statutory body, the HPCSA, and we have online teaching platforms. So due to the COVID-19 pandemic, we had to adapt and also be on par with what the rest of the world is doing. So we have upskilled our lecturers in giving you students utmost important information pertaining to online teaching platforms. Another value we really uphold at the School of Dentistry is inclusivity. So you will have access to online platforms. So in recruiting students from different socioeconomic backgrounds, we realized that some students do not have the facilities for online platforms. So at the School of Dentistry and the University of Pretoria, we have made it very accessible for the students to have their devices and to have the data to be able to be on par with the academic work. Student engagement at our university is very important. Our students are involved in different types of committees, and we are a team. Another value that we hold up high is that we are supportive. You have access to excellent teaching staff. We have access to mentorship programs. This begins from the first year on. You are mentored from the first year of study, and we have dedicated mentors for your needs. We have individualized intervention so you don't fall astray. You might be wondering, am I going to be safe at the institution due to this pandemic? Yes, of course you are going to be safe in this institution. We have made sure that before the students get into the clinical platform, they are tutored and they are given information on how to keep safe. We have a lot of equipment in our School of Dentistry so that we maintain social distancing, so that we can make sure that our students graduate on time the UP way. Another value we hold up high is fairness. There is equal treatment and equal opportunities for all the students. Each and every student is catered for. There is transparency. So our students are part of our team. So they are involved in their various committees and they have a say in whatever that goes on into our School of Dentistry. Make the right choice. If you have a passion for dentistry, if you have good communication skills, if you are a hard worker, make sure that you choose UP, you make the right decision, and you choose School of Dentistry as your first choice to make sure that you get your space. Let's change lives. Be with us and follow us in our path. Please follow the UP platform as we are waiting to welcome you into our School of Dentistry.
Thank you so much, Dr. Mfolo, and I think everybody's inspired. I'm sure I'll also probably visit the School of Dentistry as well to just check my aesthetics. As you know, we are giving away a couple of vouchers throughout the live stream, and our next lunch voucher giveaway goes to Mohammed Yassin Wadi. So congratulations, Mohammed Yassin Wadi, and I hope you will enjoy your voucher. Now, at the Faculty of Health Sciences, we do things the HSUP way. This means we graduate well-rounded and ethical students.
As the Dean, I would like to give you an idea of what we do and more importantly, how we do it. Whether we're teaching, learning, doing research, or interacting with the world at large. And we are proud to say we do it the UP way. This means living and working as ethical, socially and environmentally conscious individuals who are focused on making a positive impact on society. We get excited when lives are changed for the better. Doing things the UP way is all about enabling and inspiring our students to put their values into practice throughout their careers. Successful healthcare practitioners combine academic excellence with kindness, empathy, respect and tolerance. We teach, learn, innovate, impact and live the UP way.
Thank you for staying tuned. Now it's time for our live Q&A discussion with Ms. Celissa Anthony and Prof. Soma. Now the first question I will direct to Ms. Anthony. Now that I've been selected, what is the next step?
Thank you, Mani. Thank you for that question. And before I go on, I just would like to say congratulations to all our prospective students on getting selected and reaching this far at the stage of your career. So now that you've been selected, there are a few steps or actions that you need to take. The one is to log onto your student portal and accept the offer of the medicine or dentistry. The second thing you need to do is to complete the online contract, which is available on your student portal. You have to complete the online contract and then email, courier or post the contract to the original contract to the university. The last thing that you also have to do is to pay the initial fee in order for you to reserve your place. If you do not pay the initial reservation fee, you might lose your place and the candidates on the waiting list will then be selected. Also, keep in mind that the initial fee must be paid by the 30th of September to reserve your place.
Thank you so much, Ms. Celissa Anthony. Now, the next question is also directed to you, Ms. Anthony. How much is the reservation fee and when must it be paid?
So the reservation fee is 5,000 Rand, and as I've said previously, it must be paid by the 30th of September in order for you to reserve the place that was allocated to you.
As a follow-up to that response, Ms. Anthony, what should one's average be for final admission?
So the minimum admission requirements are still in place. So it is important that prospective learners maintain their academic standard at which they were selected at. It is also important for them to ensure that the APS in the final NSC exam do not drop with more than 2 points. If it does drop more than 2 points, prospective students will forfeit the allocated place to them. So it is very important for you to continue to work hard and to make sure that you will still meet the requirements after you receive your final NSC exam results.
Thank you, Ms. Anthony. Now, what financial assistance is available for prospective students, Ms. Anthony?
There are a list of financial aid available for students within the faculty. Students can apply either for NSFAS bursary, they can apply for achievement bursary, there's even sports bursaries available, and all the links are available on the student portal. There is also a bursary called the ISFAB bursary that is also available to medicine and dentistry students, and I would please like to urge everyone to apply well in advance because there are closing dates for submitting an application for financial aid.
Thank you, Ms. Anthony, and I'm sure this is definitely from one of our parents who's tuning in. What support structures are in place to support my child in the transition from school to university?
So Prof. De Jager has already mentioned that there are mental health programs available. So what we as a faculty also have is an excellent mentorship program where our senior students are allocated to assist all our first year students when they start their studies. We also have designated faculty student advisors that will assist our first year students with whatever challenges they may face during their studies, which can include anything from social activities, study methods, and so forth.
Thank you, Ms. Anthony. Now, as most students are wondering, which campus will I attend class? And secondly, can I defer my admission to the following year?
Our medicine and dentistry students attend the first 6 months of class on the on the Hatfield campus, which is about 7 kilometers from the Prince of campus, and then from the second semester onwards, they will then attend all their classes on the Prince of campus for the duration of their studies. The second question about deferring the application to the following year, unfortunately, it is not possible to defer your studies to the following year. If you do decide to defer, you will have to reapply again and go through the whole selection process again, and getting selected again will not guarantee any places. So we would rather advise students to accept and then just jump in there to start your career as a medical profession.
Thanks, Ms. Anthony. Next question. Do I need a laptop or internet-enabled device or computer to study at UP in 2022?
So the university uses a blended learning approach, which means classes are offered online and in person. So it is advised that students at least have access to internet-enabled device, which is a laptop. So it is necessary for them to make sure that they have the necessary support of that internet. Yes.
In light of the pandemic, everybody's wondering, will students attend classes on campus?
Well, at the moment, the university is guided by the government COVID regulations, but the university will definitely communicate with all learners and parents if students will be attending class on campus. And as I've mentioned previously, because we have a blended learning, which means students are able to attend class online, and if necessary, we will then notify when they can attend class in person on campus.
Thank you so much, Ms. Anthony. And one of our viewers is asking, good morning, I applied for BCMP in 2022, and I'm just wondering when I'll get feedback because my admission status still says it's being considered for a selection program.
Yes, so unfortunately we had to wait with the selection for our BCMP students because they still needed to submit certain documents. But everyone that applied for BCMP will know by the end of September if they have been provisionally selected. So just log onto your portal and make sure to see what your application status is towards the end of September.
Thank you so much, Ms. Anthony, and also Prof. Soma. I think the both of you can both chip in towards the response of this question. Other than providing psychosocial support for our students, what other measures are put in place for additional support? Prof. Soma?
Thank you, Momani. So we have tutors for every year of study. At anatomy alone in my subject, after a certain topic has been given and presented, the tutors will give their own lectures. And it's an excellent platform to students then to engage. We also have examination moderation meetings where student marks are monitored Should we find that the student is not coping and the marks are falling, that student will be called in to the chair of the School of Medicine, and we will then have a discussion on a one-to-one basis. Maybe there's social problems, financial problems, sometimes parents are getting divorced. So those students will be identified and the necessary support will be given. At our residence, every student has a mentor, and as Ms. Anthony pointed out, a third-year medical student will be assigned a mentee, which is a first-year student. Again, the third-year student is there to advise and direct the student. Is this an academic problem, a social problem? I am one of the mentor guardians in the program, so I am usually very much involved in that. So yes, we have plenty of academic support for our students as well.
Thank you so much, Prof. Soma. Ms. Anthony, do you want to add to that, or can we move on?
I think Prof. Soma covered everything.
All right, back to Prof. Soma. Does the School of Medicine require job shadowing and community service for admission?
So prior to COVID-19, that used to be a plus and an advantage on all students' applications. Unfortunately, with the COVID that has taken place now, it is not a compulsory item to have. However, medicine is not always easy, and we advise people to see if they can shadow with a GP. Just see what is a real doctor's life like, spend a couple of hours in casualty, and see if this is really what it is that you want to do. However, it is not compulsory.
Thank you so much, Prof. Soma. And I'm going to pass this question over to Ms. Anthony. Is it a given that first years who need residence will be given accommodation?
It's not a given that you are selected that you will be given accommodation. Students have to apply for accommodation. If you have been placed in a residence on Hatfield campus or any of the other campuses, and you are selected for any of the health sciences programs, you don't have to worry because you will then automatically be transferred to a residence on the Prince of campus.
Thank you so much, Ms. Anthony. Now over to you, Prof. Soma. What advice can be given to prospective medical students at UP who are passionate about the field but simultaneously feel a sense of uncertainty given the unexpected workload and length of study?
So that's a very good question. So yes, is medicine easy? Definitely not. Is medicine hard? Every single day. Will there be tears? Will there be 50 cups of coffee a day? Yes. Will there be visits to a psychiatrist and a psychologist? Yes. But we are there for each other. Your first point of contact will always be your lecturer. If the lecturer cannot resolve the problem, then they will be referred to the HOD. Medicine is a sacrifice, and we've all been there. So yes, we eventually become one big happy family. We will be there from day one until your child graduates from medical school.
Thank you so much, Prof. Soma. And Ms. Anthony, what advice can be given to a BSc student who currently in UP is trying to get into medicine?
Mani, I cannot emphasize enough to students that they need to maintain their marks. Students need to try and increase their marks, improve their marks, and keep it consistent. Our applications are open every year from the 1st of March. And if students need to know what the criteria is, the different categories that are available, we do have our criteria available on the web, and they're welcome to log on and familiarize themselves with the process.
Thank you so much, Ms. Anthony. As a follow-up to that question, for applicants who have applied for the 2022 intake medicine, when will correspondence be given regarding acceptance or rejection?
So the provisionally selected students' admission letters are already on their student portals, so they can download the letter to see what the conditions are that they need in order for them to have a final placement. As soon as the results, the final NSC results are uploaded in January from the Department of Basic Education, we will then also notify prospective students if they have been given a final offer.
Thank you, Ms. Anthony. And our next question is it possible to transfer from B nursing to medicine if you're currently enrolled at another university? I think this is definitely for you, Ms. Anthony.
Yes, it is possible if you are doing nursing at another university to apply for medicine. However, students just need to bear in mind that if they do apply, it's for first year. They do not get credit, although what they have studied will assist them when they are eventually selected for medicine. But it is possible, and very important is that they need to make sure that they do have the marks to get in, because it is extremely competitive to get in for medicine.
Thank you so much, Ms. Anthony. Now, Prof. Soma, over to you. Does the 2-year internship include the internship during the 6th year, or does the 2-year internship follow the 1-year SIC?
So, you know, it will be great if you can make the years of studying medicine less. So, unfortunately, 6th year is called the SIC year, and the 2 years internship is an additional 2 years. Government have been talking about making the 1-year internship just to 1 year, but that has unfortunately not yet been finalized.
Thank you so much. And over to you, Ms. Anthony. Can I transfer from Faculty of Veterinary Science to Faculty of Medicine and vice versa?
So again, not transfer. Students have to apply, and they considered based on their academic results.
Thank you, Ms. Anthony. Now, one of our viewers is asking, I had to attach a confirmation letter because the details on my ID and matric certificate are slightly different. Will this in any way affect my undergraduate 2022 application? This is definitely for student admin. Ms. Anthony?
Yeah, so it won't affect your application because our selection is based on your results. Attaching your confirmation of your ID or your matric results, it's just for us to confirm and make sure that the information is correct. But in terms of selection, it will not affect your application.
Thank you, Ms. Anthony. Prof. Summer, you're also welcome to chip in towards this response of this question. What if one's grade 11 marks are not so good? However, one's matric marks are excellent. Will the learner then be accepted?
So, unfortunately, if your application was unsuccessful now because your matric marks were not as good, your application will not be reconsidered in January. However, for medicine and dentistry, we do have a mid-year intake, so prospective students can enroll for BSc Biological Sciences and then register for the modules that are similar to what our medicine and dentistry students do, apply, and will then be considered based on first semester marks for the June-July intake for any of the two programs.
Thank you, Ms. Anthony. Now for you, Prof. Soma, is maths a module in first year in the School of Medicine?
No. As far as I know, maths is not a module, but remember you need to do very well in your matric maths to get into School of Medicine. And you will need some maths knowledge when you need to work out what a dosage or how much medicine needs to go into someone's drip. So no formal maths as a subject, but we do expect a sound maths knowledge.
Thank you so much, Prof. Soma. And also, this is directed to you. When Prof says one must maintain their mark with, what is the minimum mark mainly for a BSc student? So I'm sure they're asking more along the lines of average.
Yes. So this year, we had a selection from the BSc into the medical group. It is ranked from the highest mark to the lowest mark. I think we had placed for about 63 students. The cutoff point was an average of 84.6%. So my advice, as bad as it sounds, the closer you get to 100% in your BSc, the better your chances are of getting into medicine the second year.
No pressure. As you know, medicine is a highly competitive program. What does qualify for selection program mean? Ms. Anthony?
So qualify for selection program does not necessarily mean that you will be admitted, because due to the limited number of places available, we cannot accommodate everyone that applies. So if you do qualify based on your minimum marks, your application will be considered.
Thank you, Ms. Anthony, and over to you, Prof. Soma. When does the academic year for 2022 medical students commence, and is there an orientation?
So the first year date, unfortunately, it's not yet set. It will depend on the Department of Basic Education and when the matric marks will become available. Second, third, and fourth year medical students, we will be starting on the 3rd of January, 2022.
Thank you so much, Prof. Soma. Shortly-lived holidays. And over to you, Ms. Anthony. If we courier our contract, must that arrive at UP before 30 September, or is it only the reservation fee that has to be paid before 30 September? An important question.
Yes, it is. Thank you. So the contract does not have to be in by the 30th of September, but we do require students to at least send it before the end of the year, 31st of December.
Thank you so much, Ms. Anthony. And Prof. Soma, do prospective students have to submit a medical report?
So yes, unfortunately, we would like to know that our students are in good, sound medical health, and they would have to submit a medical report.
Thank you so much, Prof. Soma. How many students are annually accepted for dentistry? Ms. Anthony?
So for dentistry, we select 70 first-year students.
And now we have a question, especially in relation to finances. What can prospective students that cannot afford the reservation fee do?
So as I've mentioned, there are different financial aid options available. If a student is not able to pay the reservation fee, there are achievement bursaries also that are allocated to students that can be used as part of the initial fee, or alternatively they can contact our student service center, which will then assist them to see if there are other options wherein we can assist students. Paying off the reservation fee is also an option, but contact us if you do experience any challenges to pay your initial fee.
Thank you so much, Prof. Soma and Ms. Anthony, for an insightful Q&A section. I'm sure each and every one of our viewers have found the respective answers that they need. Now, as you know, our competition is still running, so please continue to engage with us on social media. And we've got 2 lunch vouchers to give away. Congratulations to Yanyi Makua and Megan van der Walt. Your student life is one of the most exciting times in your life. Our final guest for the session is one of our very own students. Ms. Mberi Shioyokarisa is the Health House Executive Committee Chairperson and the Pulse Executive Committee Chairperson, who will provide us with some insight as to what it is like to be a student at the Faculty of Health Sciences.
Come on over here, bro.
Good morning, everyone, and a very, very warm welcome to our prospective first years of 2022. My name is Mberi Shorokisa. I'm a fourth-year medical student, as well as a student representative here within the Faculty of Health Sciences at the University of Pretoria. In the time that I've been fortunate enough to call myself a Tucky, I've served on several leadership and student support structures, which play an integral role in ensuring that every student's academic and social needs are met. This is clearly illustrated through our various tutoring and mentorship programs, which allow our very own senior students to academically assist our first years with course content that they may find a little bit more challenging. Our mentorship programs are also very well run by staff members who ensures that each first year is matched to a senior student who will guide and assist them throughout their entire first academic year. This not only allows our first years to engage with our seniors and vice versa, but also allows our first years to receive first-hand advice about the new journey they are about to embark on. We've also got wonderful faculty student advisors on board who selflessly avail themselves to assist in teaching our students a variety of skills to ensure that our students can achieve the correct balance between their academic and non-academic lives. It is also within their capacity to further refer students to student healthcare services should they require it. So whether you need assistance with time management, or you need a little bit of tips and tricks about how to handle academic stress or how to prepare for your examinations, our faculty student advisors will be with you every step of the way to ensure a smoother adjustment into varsity life. Our overseeing student leadership structures and societies are also very intimately involved with our student body, providing them with several social, sport, and cultural activities, such as talent shows, workshops, sporting competitions, and even social events. This will allow our students to take their mind off their very busy schedules, as well as allow them to have fun and enjoy the company of their fellow students in safe spaces. Safe spaces that would not have been achievable without our university's 24-hour security services, who prioritize as well as ensure the well-being and safety of every student within the parameters of all UP campuses and residences. All the staff within the unit are very well trained and will gladly assist our students with any security query that they may have. Naturally, all these measures culminate in a safe, peaceful, and vibrant student environment that is conducive for teaching and learning. Though there are plenty of opportunities for our students to interact with one another and partake in extracurriculars, the greatest focus within our faculty is our academics and striving for excellence in our respective degree programs to become confident, well-trained, and world-class healthcare professionals. To enable the smooth running of all teaching and learning opportunities, our students are given access to full-time Wi-Fi connectivity on campus, as well as at all Prince of UP residences. This allows our students to keep up to date with all course content provided online, such as live lectures, assessments, as well as group tasks. Should any of our students feel that they require additional resources, they've also got unlimited access to our online library services. Our on-campus libraries are both well-equipped with study cubicles, discussion rooms, as well as convenient computer and printing services that'll make your academic journey a whole lot smoother. Our campuses are also equipped with safe and efficient bus services that transport our students not only between UP campuses, but also to and from various hospitals and clinics that they are trained in. Though we primarily focus on teaching our students to medically care for patients, should our students ever need medical assistance themselves, then we also have our very own on-campus clinic, which is staffed with a nurse and doctor whose primary concern is our students. It goes without saying that I'm exceptionally proud to be part of a university and faculty that embraces community, strives for excellence, and truly empowers the individual. Here, within our beloved faculty, each student is holistically equipped with a diverse set of skills, knowledge, and a mindset that not only allows them to grow into exceptional healthcare professionals, but also encourages them to be leaders in instigating a much needed change within our communities and the policies that govern our healthcare system. So I encourage you all to choose UP, and not only UP, but the Faculty of Health Sciences, where you will not only be groomed into an outstanding healthcare professional, but also into a life changer.
Thank you so much, Mberi. Now let's show every one of you what awaits you at Prince of Campus. Thank you so much for engaging with us online. Now it's time to announce another winner of the bookmarked voucher valued at 500 Rand. Congratulations to Gareth Visser. As with the previous winner, please DM us on any one of our social media platforms with all your details and we will let you know where to collect your voucher. Thank you so much for joining us this morning. We hope you got all the relevant information that you need to be able to be equipped to join the Faculty of Health Sciences. Stay safe, remember to vaccinate. Thank you, goodbye.